If everything else faded, what is the one thing that you would want people to remember about the UNDP and Global Fund partnership in support of the government of Zimbabwe?
Parents who lived to raise their families, young people who remain healthy, and communities that are stronger and more resilient.
From UNDP in Zimbabwe, I am Joyous Begisen. Ahead of the Global Fund's 8th Replenishment Summit, this is the Pulse Check with resident representative Dr. Ayodele Odusola. Over the past 2 episodes, we have explored the principles being championed by the summit co-hosts, that is South Africa and the United Kingdom. We have looked at solidarity, sustainability, and innovation, and how these principles are reflected in the support that UNDP provides to the government of Zimbabwe, in our role as interim principal recipient of the Global Fund HIV grant and fund administrator for the TB and Malaria grants. If you missed episode 1 and 2, you can find them on UNDP in Zimbabwe's YouTube channel. Today, we conclude the series with the final 2 principles, equity and reform, and why they are essential to sustaining gains, strengthening systems, and accelerating progress in the fight against HIV, TB, and malaria. Dr. Ayo, as we close this series, it's really good to continue this conversation with you. Let's begin with equity. We often speak of no one left behind. But how does this principle, equity, shape the support UNDP provides to the national HIV response, of course in partnership with the government of Zimbabwe and with financing from the Global Fund?
Thank you, Joyous. Equity means prioritizing those at greatest risk first. It is about aligning services with the lived realities of people and communities, rather than asking communities to adjust to systems. In Zimbabwe, equity is most effective, closest to the community, because that is where people experience health, seek support, and make decisions. For example, adolescent girls and young women continue to face a higher risk of HIV infection. With Global Fund financing, the HIV grant therefore prioritizes tailored HIV prevention approaches, PrEP access and uptake, mentorship and peer support networks, school retention initiatives, and safe spaces where young women can access information and care without fear or stigma. Financing also supports expanded service access for key populations through peer-led outreach, community clinics, and PrEP scale-up in districts with the highest burden. And in rural areas, equity is delivered every day through village health workers, supported by solar-powered health facilities, ensuring that distance, time of the day, or lack of electricity are no barriers to care. So, equity is not a slogan. It is the intentional design of how services are delivered, to whom, and with what consistency and dignity.
And the results reflect that commitment. Zimbabwe continues to conduct over 2 million HIV tests annually, and 95% of individuals who test positive initiate treatment. This demonstrates both wide service coverage and strong linkage to care. However, as you highlighted earlier, this progress is not yet uniform across all populations.
Exactly. While Zimbabwe has achieved the 95-95-95 targets among adults, we still need to accelerate progress among adolescent girls and young women, children, key populations, and communities in remote or underserved areas. These are the groups and settings where the gaps are most visible and where focused investment can drive the greatest impact. These are the contexts in which each additional investment yields disproportionate benefit, preventing new infections, strengthening continuity of care, and improving long-term outcomes. Equity is therefore the pathway to addressing the remaining gaps. It is how we advance the unfinished agenda.
Let's turn to reform. It's perhaps the least visible of all the principles, yet often the most decisive for long-term sustainability. Dr. Ayo, how would you characterize reform in the context of Zimbabwe's health system, looking at the support that UNDP provides to the Government of Zimbabwe with funding from the Global Fund?
Reform is really about strengthening the systems that make progress possible and making sure those systems can stand on their own long after a single grant cycle ends. In Zimbabwe, with financing from the Global Fund, this has meant getting the fundamentals right. Reliable supply chains, a supported health workforce, robust digital system, and strong governance. These are not always the things people see when they walk into a clinic, but they are the reason services are available, medicines are on the shelves, and data guide decision. They are what make progress last. And as we've seen from Zimbabwe's broader health investment, reform and innovation go hand in hand. Innovation gives us new ideas, new tools, and fresh ways of solving problems. But reform is what turns those ideas into everyday practice. It renovates the system so that what starts as a breakthrough becomes something people can depend on consistently. That combination is what keeps the health system moving forward, even in the face of pressure or setbacks.
So reform is how progress is protected.
Yes, the gains made are real, but are not yet irreversible. The Global Fund's investment case is clear. If momentum of financing slows, infection can rise again. Reform ensures that Zimbabwe's health system can absorb shocks, whether economic, climate, or epidemiological, or continue delivering services without interruption. It is the foundation for resilience and long-term impact. As we look ahead to the 8th Replenishment Summit in Johannesburg, UNDP in Zimbabwe continues to serve in its role as interim principal recipient for the HIV grants and fund administrator for the TB and malaria grants, working in partnership with the Government of Zimbabwe and with financing from the Global Fund. There is shared clarity on the path ahead. Solidarity brings us this far. Sustainability keeps us moving. Innovation keeps us evolving. But equity and reform are how we secure lasting impact.
Before we conclude, Dr. Ayo, please allow me to ask the question at the center of it all. If everything else faded, what is the one thing that you would want people to remember about the UNDP and Global Fund partnership in support of the Government of Zimbabwe? In tangible terms, what has this partnership looked like on the ground in terms of investment, in terms of reach, and in terms of lives saved?
Absolutely. And it's an essential question because at the end of the day, impact is about people, not numbers. From the ongoing socio-economic impact assessment of Global Fund investment in Zimbabwe, we're seeing results that speak for themselves. Since 2009, these investments have helped avert more than 500,000 deaths, including over 110,000 children. We are also seeing real progress in prevention. The partnership has contributed to a reduction of nearly 800,000 new HIV infections. In practical terms, this means about 50,000 Zimbabweans every year who did not contract HIV because services were within reach when they need them. These figures are not abstract. They reflect parents who lived to raise their families, young people who remain healthy, and communities that are stronger and more resilient. That is what this partnership looks like on the ground. Real lives changed and real futures protected.
The work continues. This has been the Pulse Check from UNDP Zimbabwe with resident representative Dr. Ayodele Odusola.